the whole retina.
No, we're using the macula. We're using this rug area to read.
And so that's the most critical part to be able to see.
Yes. So imagine the macula to be 42nd Street and Broadway in New York City, but the entire eye is the United States. So that area, 42nd Street and Broadway, is giving you the ability to see. So that area has to be protected. The rest of that area, that whole large area, is important, but not as important as that one area called the macula. The macula comes from the Greek word meaning spot. So that area has the highest concentration of cells called cones that give us color. Red, yellow, blue, that ability to see the beautiful colors in the flowers, and that gives us the ability for us to draw a fine straight line, or for us to see whether that line is crooked or wavy. So that ability lies right in that one spot called the macula.
So,
and that area can get eye disease very quickly. The first part is that could be that area to go when you have diabetes, especially type 2, the acquired diabetes, adult onset.
So there are two types of diabetes, one that tends to occur earlier in life and one that tends to occur later in life. Do you see this with both types of diabetes?
Oh yes, we see diabetic retinopathy affecting the retina in both types. So what happens in type 1, you don't have insulin, or you're just, at a young age as a child. And in type 2, your insulin doesn't work well enough to take care of the glucose.
So either way, untreated, you walk around with high sugars.
Right, and you're causing cell death, and therefore you can cause lack of oxygen to the areas of the retina that need it and loss of vision.
Is this fairly common?
7 new cases are diagnosed every hour. So it is 65,000 new cases a year. It is the leading cause of blindness in age 21 to age 74 in America. So it is common for me to see in my office.
And so what should a patient do if they have diabetes?
Well, first off, they should see their regular doctor to make sure that their blood glucose is under control, and ask for a hemoglobin A1C level, because that gives you a 6-month window as to what it has been. And good control means that hemoglobin A1C level is at 6.0, or aiming towards that direction. Then if they have that, they can have 20/20 vision the rest of their lives. This has been shown in the diabetes complications and control trial in 1994, and the United Kingdom prospective diabetes study in 1998.
So if you have diabetes, you don't have to get eye disease if you're able to control it early and keep your sugars
Exactly.
low.
We have very famous people with diabetes who have spoken for the American Diabetes Association, who've kept their diabetes under control. For example, Ella Fitzgerald, B.B. King, Mary Tyler Moore, Hal Berry has spoken for the American Diabetes Association, and Elvis. Elvis had diabetes. He did not take care of his diabetes, though. One other thing to add for the home audience is that when the doctor makes a diagnosis of diabetes, not only do you have to take care of your blood sugar, it is important to see an eye care specialist, your eye doctor, an ophthalmologist, to make sure what your vision is, because 21% of people with type 2 diabetes present with diabetes in the eye, in the back of the eye, diabetic retinopathy. So it is important to have that taken care of early, because then you can have 20/20 vision for the whole lifetime, instead of just good vision for 5 years, then you lose it. Because the statistics are sad. Almost more than 95% of people after 25 years of type 1 diabetes, this is the juvenile onset, will have severe diabetic retinopathy. And over 60% of type 2 diabetes after 20 years will have diabetic retinopathy.
So controlling sugar is very critical. What else do you have to offer these patients?
Well, for treatment, once we see them make the diagnosis, when they come to my office as a retina surgeon, retina specialist, we dilate their eyes, we look inside, and we're able to see the entire retina, and see at a 50 micron resolution level if they're bleeding, and we can treat them with laser, take care of these little 50 micron spots. So if we imagine a room this size being the inside lining of the eye, and where we're standing is the macula, the 50 micron spot would be the size of a quarter. So taking care of that would be very easy at the early stage than waiting for a later stage when 1/4 of the room is bleeding, and that we would then have to do laser to many more areas of the retina.
And so it sounds like the most important thing, other than controlling your sugar, which will prevent this, is to make sure that you're actually evaluated by an eye care specialist.
Yes, and it's common to be dilated. Many patients worry that dilation will hurt them or it's a bother, they can't go to work. But remember, you can get a new car, a new knee, a new shoulder, but you can't get new eyes. So we think it's a very small price to pay for us to really evaluate what's going on and make the correct diagnosis.
So by dilation, you just mean the eye drops that get put in?
Yes.
And so that the pupil opens up,
yes,
so you can get a better view of the back of the eye.
Right, and usually after 20 minutes they can drive, and after 1 hour they can read the computer, and after 3 hours they can read a regular book. So some people are afraid that they will miss a day of work, they can't drive themselves home, but that's not true. And so when they come in, they say they cannot see and they have newly diagnosed type 2 diabetes, that they're 40 years old, they suddenly feel that they can't read, they go to their optometrist, they got many new pairs of reading glasses, but none of them help because they read the San Jose Mercury News and there's still a smudge in the center. What you would expect to do at my office is be dilated. We then look at you with something called a fluorescein angiogram, where we would inject dye into your wrist or your arm, and that dye would travel to your eye in 13 to 15 seconds, and the doctor would then get a giant video of what's going on, digital picture, and know at which stage of the retina is having the disease process, and that would help the specialist figure out whether you need just eye drops, more control of your diabetes, or laser. And there's two types of laser. If it's only the macula that's affected, like the center spot, the rug, and the size of the lesion, the size of the quarter on this rug, or 50 microns, 100 microns, we would laser at the same day at the office and take care of it, and they can expect to see better within 2 to 6 weeks. If areas of the retina, like the walls of this room, are leaking blood, they would expect a more extensive laser that would last about half an hour in the same exam room, or even having several sessions coming back to treat areas of the retina that are leaking blood. Then that process, because it takes longer, the recovery of vision may take longer as well. So you may not see as well. You may have to wait 6 months to see better.
So as I understand, in addition to the actual leaking of blood and bleeding, the insufficient blood flow causes new blood vessel formation?
So what happens is that if you imagine these pipes that have holes in them because the endothelial cells have died and they're leaking blood. So what happens if you lose a lot of endothelial cells, the lining of the pipe, the body creates abnormal new cells to cover up, to sort of form scar tissue. And these new cells that